How do treatment options for bladder cancer differ by stage? Understanding how treatment options for bladder cancer differ by stage is essential for patients and their families. The stage of bladder cancer indicates how deeply it has invaded the bladder wall and whether it has spread beyond the bladder. In the early stages, known as non-muscle invasive bladder cancer, or NMIBC, the cancer is confined to the inner lining of the bladder. Treatment usually starts with a procedure called transurethral resection of the bladder tumor. This involves removing visible tumors through the urethra. After this, intravesical therapy is often used. This therapy delivers medication directly into the bladder to help reduce the risk of recurrence and progression. A common treatment in this category is Bacillus calmette-Guerin immunotherapy, which helps stimulate the immune system to fight the cancer. Recently, a new formulation of mitomycin has been approved that can be administered safely at home, making it more convenient for patients. The goal here is to prevent the cancer from returning or progressing to a more serious stage. As we move to muscle-invasive bladder cancer, or MIBC, the cancer has invaded the muscle layer of the bladder wall. Treatment becomes more aggressive at this stage. Radical cystectomy, which is the surgical removal of the bladder, is often performed along with urinary diversion. Neoadjuvant chemotherapy, which is chemotherapy given before surgery, is typically recommended to improve outcomes. For those who cannot undergo surgery, chemoradiation may be an option, combining chemotherapy and radiation therapy. There are also emerging treatments like cancer vaccines and immunotherapies being studied, but they are not yet standard practice. In cases of metastatic bladder cancer, where the cancer has spread to distant organs, systemic therapies are the primary treatment. Chemotherapy remains the first-line treatment in these situations. Immunotherapy, particularly with checkpoint inhibitors, is approved for some patients. Ongoing clinical trials are investigating new agents, including cancer vaccines, but these are not yet widely available. In summary, treatment for bladder cancer is tailored to its stage. Early-stage NMIBC focuses on bladder-sparing methods to prevent recurrence. Muscle-invasive cancer requires more aggressive treatments, including surgery and chemotherapy. Metastatic cancer is addressed primarily with systemic therapies. Recent advances, such as home-based intravesical treatments, may enhance the quality of life for early-stage patients. However, it is crucial for all treatment decisions to be personalized and made in consultation with healthcare professionals who specialize in bladder cancer care.